Hello, this is Valerie. Welcome again to another social issue topic. And today I will be addressing addiction and specifically what it is, the causes, its impacts, and then look at some interventions. So, addiction is a significant issue in Canada, affecting individuals, families, and communities. It comprises dependence on substance such as drugs and alcohol, as well as behavioral addictions like gambling and internet use. So I will look at the causes of addiction primarily as it relates to Canada. So we have some causes, and one of those causes are biological factors, which has to do with genetic predisposition and brain chemistry, which can make individuals more susceptible to addiction. There's also the psychological factor, which looks at mental health disorders such as anxiety, depression, and trauma, often reoccur with addiction. And so there's social and environmental factors as well, which has to do with peer pressure, family dynamics, poverty, and exposure to substance. And that play a key role in this factor. We also have cultural and systemic issues, and this is mainly with marginalized groups, including indigenous communities, faced with higher addiction rates due to systemic inequality, intergenerational trauma, and historical injustice. Example is the residential school history. So, as well, there is accessibility and availability. Each access to alcohol, prescription medications, and illicit drugs increases addiction risk. So now we've seen the causes. So how does it affect the individual? So addiction, whether it be alcohol or drugs or gambling, it affects the individual physical health, and there's long-term substance use, which can lead to organ damage, overdose, and chronic illnesses. With regards to mental health, it can affect them. Often it worsens their mental health, and it leads to mood disorder, anxiety, and sometimes even suicidal ideation. And there's also another effect on individuals, which is also the social isolation aspect. And in this aspect, addicted individuals may lose relationships and social connections due to their behavior changes. And there's also another impact, which is obviously the economic impact. And in with this aspect, addiction can lead to job loss, financial instability, and homelessness. So, how does addiction affect children and families? Well, emotional strain is put on the family, and when that happens, family members may feel helpless, angry, and resentful. And another effect is intergenerational trauma, and that is when addiction in parents can create unstable environments leading to emotional neglect or abuse of the children. And there's also another impact on the children, which is higher risk of developing mental health and behavioral issues, and also poor academic performance and difficulty forming relationships. We also have another, real impact on the family, which is the family breakdown. And when that happens, addiction can lead to divorce, separation, and strained family bonds. So people no longer stay together. The children probably are apprehended, and some may go live with family members, and it's just some will just be lost in the system, and there will be no bond within the children and their parents. So, how do we intervene or treat this addiction so that it doesn't impact the individual, children, and family? Well, one way is prevention and education, which is to raise public awareness through campaigns, and Canada National Anti-Drug Strategy is an example of this. There's also school programs teaching healthy coping skills to children. We also have community support, and there is the harm reduction being used. It's an approach um, that supervise injection sites and naloxone distribution. So there's also outreach programs for vulnerable populations, and there's the treatment options, and one of those options are detoxification, which is through medical supervision during withdrawal. There is also rehabilitation programs for inpatient or outpatient treatment focusing on recovery. We also have other treatment options such as medication assisted treatment. It's called MAT, MAT, and this is using medication like methadone or buprenorphine or opium addiction. And these medications are taken so that it helps them to win them off the street drugs. So, still with treatment, there is therapy and counseling, cognitive behavioral therapy, and motivational interviewing is used. We also have family therapy to address the relationship dynamics, and there is also support groups, peer-led groups like Alcoholics Anonymous. There's also Narcotic Anonymous. We also have programs like Al-Anon, or Non-Anon for families of addicts, and we also have indigenous centered approaches, which is incorporating traditional healing practices and cultural reconnection for indigenous individuals. So these are the form of treatments that are being used in Canada. And let me just say that addressing addiction in Canada requires a holistic approach that considers the individual, the family, and societal factors. And effective interventions involve prevention to start with, harm reduction, treatment, and ongoing support system tailored to the unique needs of individuals and their families. So, recognizing and addressing the system roots of addiction, especially in marginalized communities, is essential for lasting change. And as we all know, addiction is like any other illness. So if you have somebody who is addicted to whether alcohol, drugs, or gambling, or any other thing that, you know, is impacting the family, themselves negatively, you need to reach out to them and let them know that there is support. Let them know that there is help out there. Navigate the system. Find out the resources in their areas, in their communities that will be beneficial for them. Ask them to visit their doctors to make referrals. Doctors can help. There is also counseling. There's also therapy. So all of these things that I've named, if you don't know who to talk to, walk into a clinic, talk to a nurse, ask questions. Yes, you can be drinking, but there's help for people who are addicted to whether alcohol, drugs, or gambling. All you need is to ask for help. And if you have relatives that find themselves in this position, please help them. Be not judgmental, be supportive, and be kind. Once again, I thank you for stopping by and for listening to my video. I hope this was helpful. Until next time, when I shall bring you another topic on social issue or mental health issue. Have a good day. Bye for now.